you will not hear me. I'm on staff with Healthcare Consumers, and I'm up here to present the Activist of the Year Award. Becky's sitting right down here, so I don't have to tell her to start on her way up. Activist of the Year Award goes each year to a member of the community who exemplifies and embodies the mission and practices of Champaign County healthcare consumers. Quality, affordable healthcare for all, participatory democracy, grassroots community organizing, and bringing the voices and priorities of consumers to bear on the healthcare system. You may remember last October when it was announced that two popular local independent physicians, Frank Ressler and Imhotep Carter, were being kicked out of Personal Care HMO. Personal Care and Christie Clinic announced that it was a business decision, and they gave the patients of the two doctors about 6 weeks to establish new primary care physicians. The News Gazette ran a front-page story on this. Included in that article was a sidebar containing the information that patients of the two doctors were not going to just accept the decision, and that they were going to meet the next weekend at Champaign Public Library. Now, the person who told the News Gazette reporter that there would be this meeting was Becky Heller. So, at CCHCC, we were very interested in these events, in part because some of our board and staff are patients of Dr. Carter and Dr. Ressler. So we called Becky and introduced ourselves and asked if we could attend and if she could use any help in organizing the meeting. And that began a great partnership. Becky told us that she's used to fighting on her own, especially for her children. Apparently she was very well known, though not necessarily so well loved, by certain administrators in the Champaign public school system. But what she was not used to was the group effort. And she said she suddenly found herself involved in something that was bigger than just herself and her family. Becky started getting calls from all kinds of patients of the two doctors, from people who had been seeing their doctor for years and who were sick, who were frankly terrified at the prospect of having to go somewhere else. This isn't about me anymore, she told me. She said, these people need to stay with their doctors far more than I do. I can't mess this up. Well, she did. In a whirlwind 6-week campaign, an inspiring and dedicated group held several public meetings, sent out postcards, letters to the editor, letters of complaint, and every other thing that goes into a grassroots organizing campaign. Becky not only fielded calls, she also pitched in on bulk mail duties, worked with news media representatives, and communicated directly with the decision makers at both Christie and Personal Care. At our public meetings, she and Claudia co-facilitated and acted as spokespersons. And as most of you know, we won. Both Dr. Carter and Dr. Ressler are still available to members of Personal Care HMO. And the fundamental relationship between Personal Care, Christie, and area physicians has been changed. And a message was sent to healthcare providers and health insurance corporations in the community that the people in the community will not meekly go along with corporate decisions that harm the community. Just as important, and I know Becky feels this way too, many of the people involved in the campaign were getting their first taste of community activism, and none of them will ever be the same. I can speak for the CCHCC staff and for Becky in saying that it was pure pleasure to work with all of the people involved in the campaign, and it took all of us to win. But everyone involved also recognized that Becky was taking the lead and spearheading the effort. So I'm very pleased to present the Activist of the Year Award to Becky Heller. Next, I would like to present present the Harry J. Baker Community Service Award. The CCHCC Board of Directors awards the Harry J. Baker Community Service Award to individuals or organizations who distinguish themselves in their work on behalf of the community as a whole. This year's winner is Barbara Pritchard. Barb has worked for social justice for people with disabilities for 15 years. She began working at PACE, Persons Assuming Control of Their Environment, in 1986. Since then, she has helped countless people with disabilities achieve an independent lifestyle. She currently is the program director at PACE, and she is responsible for their advocacy and referral efforts in a multi-county area. Barb fights for disability rights on several fronts. Just to name a few, she works on accessibility issues, on transportation issues, and on healthcare issues. She has spearheaded efforts to provide affordable, accessible housing in this community and across the state. She's a leader in Citizens for Homes, an organization that is a state leader in pushing the goal of visitability in housing. Whenever I see Barb, she's usually excited about a new project, or she's outraged by another injustice, or usually both at once. She seems to find it infuriating when people who have the power or opportunity to do the right thing just can't be bothered to make the effort. So Barb makes the effort for them. She makes sure that those people are bothered one way or another. And she does so with an eloquence and a persistence that can't be dismissed. She gets results, either by convincing them of her viewpoint or by convincing them that doing the right thing is easier than being targeted by her. When local government agents, governmental bodies go to make their consolidated plans, they can count on being visited by Barb each year, telling them that they need to get their policies right concerning people with disabilities. And she will keep going until they do that, and then she'll keep going to make sure they keep it that way. Recently, Barb single-handedly organized efforts that made the Housing Authority of Champaign County seek available additional funding for low-income people with disabilities. In addition, Barb has provided tremendous leadership, education, and assistance to other community organizations, including CCHCC, the Community Health Partnership, and the Women's Direct Action Collective in their efforts to include disability rights issues in their work. So Barb, for your leadership, for your strength, vision, and commitment, CCHCC is happy to present you with the Harry J. Baker Community Service Award. Hi, my name is Bill Mueller, and I will be presenting the Harry J. Baker Community Service Award tonight. This award is intended to honor community members whose dedication and work toward healthcare justice stands out and makes a concrete difference both in our organization's work and in the lives of people in the community. I'm very pleased to say that this year's recipient is Carmen Reed. Is an integral member of the healthcare consumers family. She's also a long-standing member of the Medical Billing Task Force, helping us devise strategies and using her own healthcare experiences to gather key information that the task force has then been able to use in its fight against illegal and unethical medical billing practices. She also overcame a reluctance to fly in order to travel to Boston with Claudia last year. There, she and Claudia represented healthcare consumers at a national conference of grassroots organizations working on healthcare issues. Carmen now also participates in the Community Health Partnership and in the Access to Care Working Group. At a recent Community Health Partnership meeting, It became evident that our major healthcare providers were yet again determined to avoid any real commitment or any real responsibility for improving the health of our community. Carmen was outraged, and she usually doesn't say a lot at these meetings, but she did at this one, speaking quietly in the manner of the retired school teacher that she is. She passionately and eloquently just dressed them down for their pettiness and their self-serving greed. It was great. Several partnership members still talk to me about it when I see them. And I also got the impression that day that some of the providers' representatives, and these are people who aren't generally known for exhibiting much sense of camaraderie or connection with the rest of us or with the larger community, I think they actually felt embarrassed. And Carmen, you're the only person who could have pulled that off. For that and many other things, Carmen, it gives us great pleasure to present you with the Harry J. Baker Community Service Award.
I guess this year I shouldn't be as nervous as I've been for the last.
And again, sit back and enjoy. And the first awards presentation is by Bill Mueller.
Hi, as she said, I'm Bill Mueller, and I'm up here tonight to present the Elsie Field Provider of the Year Award. This award recognizes an individual or an organization that has made a distinctive impact within the healthcare system. This year, we're recognizing the Champaign County Health Department's Child Dental Access Program. We're doing so for its innovation and for its service to the children and the families of Champaign County. In just over a year of operation, the program has enrolled more than 700 children for dental care, and it has provided oral health education to more than 3,000. It has attracted statewide attention as a model for community engagement and creative health solutions. So we want to recognize all of the participating dentists, specialists, hygienists, dental assistants, and others who've made the program such a stunning success. Accepting the award tonight is Program Coordinator Lisa Bell, who many of you know. She's a pleasure to work with. Lisa deserves tremendous recognition for her vision, her determination, and her energy. She's built this program from the ground up. It wouldn't have happened without her. Lisa often says of the program, quote, "It is my passion," end quote. That's simple enough, but what is amazing is Lisa's ability to communicate that passion and to make it infectious. This can be seen in the remarkably broad and enthusiastic community support for the program. Now, Lisa's not without her critics. At a meeting last year, I saw a public health administrator point an angry finger at her and say, "Lisa, the only reason these dentists are participating is because you persuade them to." Still don't know what that means. At any rate, here's to persuasion. Here's to Lisa for being so persuasive. And here's to all of the dental professionals who have allowed themselves to be persuaded. Our community and our children are much better off as a result. Lisa, thank you.
Bill and Colette.
Hi, as you might guess, my name is Bill Mueller, and I'm on staff wing of the organization. They're responsible for setting the direction that this organization takes and for ensuring that we stay true to the organization's mission. They're also responsible for the actions and behavior of healthcare consumer staff, which probably makes us nervous. It doesn't, it should. And our current board includes people from a wide variety of backgrounds, including several with vast experience as social justice activists. They're very hands-on about helping us set goals and strategies. And they're very energetic and creative in doing so. And the creative part of that makes us nervous sometimes. But it's a good mix between board and staff. And the recent successes and victories we've achieved could not have come about without their guidance and participation. Now Paulette will introduce the board. Now, I would like to extend a special welcome tonight to employees of Champaign-Urbana Public Health District who are in attendance. As most of you know, CCHCC employees are in the middle of forming a union and affiliating with AFSCME Local 31. In fact, the new union has already been certified by the Illinois Labor Relations Board. The reasonable and proper course for the CCHCC Board of Administration would be to welcome the new union and work to develop a solid relationship. Unfortunately, that's not what's going on. The CCHCC administration, supported by 2 of its 3 board members, has chosen to try to keep the union out. They have, at last count, spent at least $50,000 of our tax dollars to hire a law firm that specializes in union busting. They have challenged the certification of the new union in court. Meanwhile, the CCHCC administration is engaging in a vicious internal campaign of intimidation and retribution against employees it suspects of being pro-union. 2 dental hygienists who just happened to be on the union bargaining committee were laid off on June 23rd. As of now, there are no dental services at all at CCHCC for the children of Champaign and Urbana. In addition, qualified nurses with 4-year degrees on staff have dropped from 9 to 4, with the result that preventive education at schools and health fairs has dropped, and home nurse visits to seniors and people with disabilities throughout the county have been drastically cut back. Employees who complain about deteriorating services are silenced. So, tens of thousands of tax dollars are going to a horribly destructive anti-union effort at the same time that staff and services are being reduced and the people of Champaign-Urbana who rely on these services are being harmed, and there seems to be no end in sight. In the face of all of this, these employees continue to stand and fight, showing tremendous courage and determination, risking their jobs and their careers to stop layoffs and cutbacks in services and to exercise their right to unionize and bargain collectively. These employees are not only looking out for their own workplace, they're fighting to save our public health district and maintain public health services for the residents of our community. Their struggle is our struggle, and they need and deserve our appreciation and our support. Now, to discuss how you can help out, contact me after the dinner. For now, please join Healthcare Consumers Board and staff in welcoming these CCHCC employees and expressing your support of their efforts. held above all for this service to healthcare and community. There always are a lot of candidates, but this year there wasn't really a contest. Just President George W. Bush. Once we started talking about what should we include, what transgressions should we list in a brief speech, everybody had their favorites and we couldn't get them all in. So we're just going to do a few and we'll probably leave out some that you'd like to talk about. And let me run down them quickly. He pushed through a cynical piece of legislation in the guise of Medicare reform and prescription drug relief that even now is boggling everyone's mind how bad it is. He's reduced veterans' health benefits while sending our young people into an obscene war. He's advocated before the Supreme Court against the right of states to give their citizens the rights to sue HMOs. He's pushed and continues to push for caps on malpractice awards for patients harmed by incompetent physicians. He's opposed all efforts by individuals, cities, and states to rein in prescription drug expenses. And we'll just leave it at that. You have your own, and he deserves it, no question. Thank you.
Switcheroo, and then we'll get
Hey, I'm Bill Mueller. I'm on staff at Healthcare Consumers.
And I'm Paulette Coleman on staff at Healthcare Consumer Hospital.
We're up here to introduce you to the CCHCC Board of Directors. The Board of Directors of Healthcare Consumers is made up of individuals who volunteer their time to oversee the functioning and well-being of the organization. They're responsible for setting the direction that this organization takes and for ensuring that our organization stays true to mission. They also are responsible for the actions and behavior of CCHCC staff. Our current board includes people from a wide variety of backgrounds, including many with long experience in community activism. They are very energetic and creative in making policy and developing strategies, as well as in participating in our issues campaigns and our fundraising efforts. Above all, they're fiercely supportive of staff and of the interests of our organization's members and constituents. It's safe to say that our progress and our victories over the past few years would never have happened without our board. Now, Paulette will introduce the board members. I believe both Dr. Woodruff and Dr. Shute are here tonight, so if you could, at your leisure, head on up here. I talk more slowly than Brooks, so you have some time. I'm up here to present the LC Field Provider of the Year Award. This award recognizes an individual or an organization that has made a distinctive impact within our local healthcare system. This year, we're recognizing 4 of Champaign County's dentists, each of whom has shown tremendous compassion and professional dedication to improving the oral health of our community and to providing care to those in our community who are least able to afford and access dental services. The 4 award recipients are Dr. Valerie Woodruff, Dr. Scott Anderson, who could not be here tonight. Dr. Norman Shute. also want to be sure to express our gratitude to the staffs of each dentist's office. Dr. Woodruff's staff is over here, and she'd like them to stand. As you may know, Healthcare Consumers has operated a dental referral program since 1992. This program allows low-income adults in the county to be treated by participating dentists on a sliding scale fee basis. Let me emphasize that the dental referral program is the only affordable dental care program for low-income adults in our community. Doctors Woodruff, Anderson, and Shute are the dentists who participate in the program. And in fact, with this year's award, the three of them become two-time recipients of Provider of the Year. We recognize them for their dental referral program work 7 years ago in 1998. Since then, the needs of our community have actually grown, and the plight of low-income adults needing dental care has only gotten worse. Doctors Woodruff, Anderson, and Shute have stayed with the program all along, showing, again, great commitment, flexibility, patience, and above all, compassion. And 4 years ago, Healthcare Consumers and leaders from the County Board of Health organized to create the Child Dental Access Program. Funded primarily by the Champaign County Board, this program provides free comprehensive dental care to low-income county children. It does so by enlisting private dentists who agree to accept 50% of their usual fees for providing the care. The program has treated thousands of Champaign County children who would otherwise have gone without needed dental care. And the program has received statewide and national recognition as a model for public-private community partnerships. Dr. Anderson and Dr. Woodruff both participate in the program. We, of course, should all thank them for doing double duty, serving both children and adults. We also need to thank and to recognize Dr. William Lavery. Dr. Lavery has been incredibly generous in opening his office in Rantoul to program coordinator Lisa Bell, allowing her to screen and enroll hundreds of children. Dr. Lavery's support has helped form the backbone of the Child Dental Access Program, and his generosity and support have been key components in the program's great success in reaching children and families, in going into schools and Head Start, and in the program receiving the recognition that it has. So, Doctors Woodruff, Anderson, Shute, and Lavery, on behalf of Champaign County Healthcare Consumers and all the community members, children and adults, whose lives have been improved by your compassion and professional care, it gives us great pleasure to present you the Elsie Field Provider of the Year Award. We knew this day would come, and it's sad. Of course, we wish you well in your new job, but you know you won't find another organization like Healthcare Consumers. And we hope you'll keep us in mind, especially when you donate. And always, keep in the back of your mind the possibility of coming back. You may need to run this organization someday. Claudia's no spring chicken.